What's happening? This is CKD, what you need to know and how to prevent and treat it. Come on, with Kidney Health Coach T. Thank you so much for joining me. Come on, let's go. What are those kidneys? What do they do? What is this thing called CKD? And here are some ways to prevent and treat it. All right. What do the kidneys do? All right, they're two bean-shaped organs. Where are they? In the lower parts of our backs. Your kidneys, they are vital, pertinent, all right, vital organs. You need at least one kidney to be healthy, all right, and to live. Actually, you can be born with just one, you can survive with just one, and have a healthy life. And as for me, that is my case. I have one kidney, and that's from my deceased organ donor. And I am living well. Thank you so much. All right. So, what do those kidneys do? I'm glad you asked. They filter waste and they remove this excess fluid, the extra fluid, all right, from our blood to make urine. They also help keep our bones healthy. They make this thing called red blood cells. They control the blood pressure and they keep the right amount of minerals and nutrients in our body. If you can think about a traditional coffee pot, if you will, the coffee or the water comes in to the coffee pot. There's a filter there. There's also coffee grounds there. The water comes through. The filter cleans it out. You get fresh cup of coffee that you're able to drink. Same thing with our kidneys. The blood flows there. It enters into the kidney. The kidney acts as a filter there. Again, to filter out not coffee grounds, but to filter out the waste, the excess toxins that are built up in our bodies. And that comes from the food that we eat every day, our drinks, everything that we are consuming. All right. It filters it. All right. And it flows through. And what do we get? We get urine that is expelled. So, what happens when these kidneys are damaged? I'm glad you asked. The damage to the kidneys, they keep us from working well. All right. So if they're not working, our body is not working well either. All right. It means that this waste, this excess fluid that I'm talking about, it builds up, it stays there in our bodies. The blood again enters those kidneys. The kidneys are damaged. The blood vessels itself are damaged from one reason or another. So it doesn't filter out, again, all that excess fluid, all the excess waste, all those toxins. They stay in our body and they are building up. All right. All right. So again, this thing called CKD or again, chronic kidney disease. It can be permanent damage to your kidneys. Again, like I said, the blood vessels there are damaged. The damage will not go away and it may get worse over time. All right. Not for everybody, but definitely we want to make sure that, again, we're maybe making some lifestyle behavioral changes so that we can prevent the progression. All right. And so, again, like I'm going to share just some ways that we may be able to slow down that damage. Again, not for everyone, but we're going to definitely do our best to try. So here's a question I'm going to throw out to you. How many adults in the US have CKD? Can you guess? Is it A, 5%, B, 15%, C, 50, or D, 75%? All right. Well, here it is. The answer is B there, 15%. And if you need more information for the calculations, that's about 1 in 7 adults here in the US have CKD, chronic kidney disease. Some of them don't even know about it. We're walking around and unaware. All right, there are 5 stages, if you didn't know, of CKD, chronic kidney disease. All right, that first stage is stage 1 there. There's mild damage. You won't notice a thing, all right? And your doctor probably won't say anything about this either because there's normal to slight loss of function there. All right, so nothing to worry about, nothing to be so concerned about at all. Stage 2 there, same thing. All right, there's mild damage. All right, this may come about with age as well as we mature. All right, but there's again mild loss of function. Nobody notices. You don't know any changes in your body there. But as we progress into stage 3, 3 is divided into 3A and 3B. There's definitely something that you notice there, some differences. All right, there can be some mild to moderate damage there. All right, and so that is maybe mild to medium loss of function with your kidneys. All right, 3A, and again, like I said, 3B, you're going into it a little further. It's progressing. There's moderate to severe damage there. and there's definitely loss of function, and you're going to experience some symptoms. All right, and definitely into stage four, severe damage, and then stage five is the final stage there. That is called kidney failure, ESRD, or ESKD. All right, that's end stage renal disease or end stage kidney disease. Definitely, there's loss of function there, near to total loss of function. It's severe. And at this stage, you're definitely going to have some symptoms there. All right. And like I shared before, ESRD, ESKD, that's the final stage there, stage five. Kidneys have stopped working well enough to keep us alive, to keep us going. All right. So at this stage, you may need some dialysis, some treatments there, dialysis or a kidney transplant. Those are some treatments to help you stay alive. All right. Or help you have a better quality of life. All right. And if you can see there on the side of the screen, on that right hand side, that is a dialyzer. All right, dialysis machine there. All right, nothing to be afraid about, but it can, like I said, can assist you to living a healthier life. Definitely if you're in stage five kidney failure there. All right. So it can get worse over time. All right, it may for some people. All right, again, nothing to be afraid about. But most people, they have no symptoms, again, like I said, between those stages of one to three. You're not going to feel anything, but again, it's 3A and 3B. Definitely, you're going to notice some changes. All right. Now, the only way to know that you have CKD or chronic kidney disease is to get tested. And I'm going to share some ways in a minute. All right. So stay with me. Again, I'm glad you joined me. So if your kidneys, they start failing, all right, you're going to notice some of these changes. Those are some pictures there. I'm going to tell you in 2 seconds a little bit more about what they mean. All right, you can look there at the first one. There's going to be some dry, itchy skin. All right, and again, these are at those latter stages when it's well into stage four and stage five. You're going to feel again muscle cramps there. You may feel this especially at night while you're sleeping. You may feel sick to your stomach, nauseous, like you may want to throw up. That's early in the mornings, maybe. And then for some people, all throughout the day. You may not feel as hungry as you used to. You may not have an appetite to eat. Definitely, this is a symptom that a lot of people experience at those latter stages. You may have some swelling, what we call edema, in your extremities. That could be in your hands, your feet, or your ankles there, and sometimes in your face as well. All right, there's going to be some decreased urine as these stages progress into stage five. And then sometimes at stage five, there's no output at all. So that means no urine at all. There's some trouble catching your breath, maybe from walking from your car, running your errands into the grocery store. You may feel this where it just feels like you can't breathe sometimes. It's hard to breathe. And also the last one, trouble sleeping. Some people may think they have insomnia, but these are some of those symptoms, again, of kidney disease. And that is that, especially at those latter stages. There's some other health problems that may come about. That's anemia, not enough red blood cells, like gout. Have you heard of that? Some people have experienced this. I've experienced it myself when I was on dialysis, but it is a type of arthritis. Right? And so if you're definitely experiencing any of these, definitely talk to your doctor. There may be something that they can do to help or assist or alleviate some of this for you, but definitely want you to engage and open up. Here's the last one there, hyperkalemia, all right, high potassium, too much potassium in your blood. And too much potassium in your blood can cause other health problems or issues with other organs in our bodies, especially our heart as well. So we definitely want to be mindful of that. But these are some of those symptoms, those health problems, again, that may be a sign of CKD, chronic kidney disease. Now, if you find out that you have CKD, and if you find out you got it early enough, you may be able to slow down that damage, prevent it from getting worse. You may be able to, all right? Not for everyone, but again, we're going to give you some simple tools, some tips, some strategies, some of those resources so that you can at least try, okay? All right, again, this CKD, if you're in those latter stages, definitely this can be damage can be usually permanent. All right, it is usually. All right, we definitely want to find out about it in advance all right, before you get into those latter stages. So we ask that you open up and engage with your medical professional, usually maybe your primary care provider. Definitely when you're going into your annual appointments, ask, open up. If they don't mention it, definitely you do. Ask to be tested, all right, for CKD, for kidney disease. And I'm going to share some of those tests with you a little later, all right? So we want to make sure that you are the MVP of this here team. You have your medical professionals there, but we want you to be a part of that team and be a team player and definitely ask about these CKD tests. Definitely ask about where you are and in kidney disease there. We definitely want you to be mindful and note this as well. It's very important. Why? Because anyone there can get CKD, anyone. If you have diabetes, if you have high blood pressure, if there's heart disease, if you've got a family history, that means anybody in your family, the generation before you. Definitely, if you are Black, African American, Hispanic, Native American, Asian Pacific Islander, not to say that other areas or other people or other cultures do not get that, but it may be more prevalent, and your risk may be higher if you are in one of those categories or cultures that I just discussed. And again, here, as you age, as you mature in age, CKD or that may progress. All right. And that means if you're over 60 or above in age. All right. So it's definitely something to be mindful about, definitely something to keep note and keep a track of. And again, engage with your medical professional, your primary care doctor about it. It's very important. What is the number one cause of CKD? Again, I'm glad you asked. Is it A, your age? It may be. Is it B, alcohol, diabetes, high blood pressure? The answer is diabetes, all right? This may be one of the main causes there of CKD, diabetes. That's why it's very important if you hear that you have this or a family history of it, that you're making sure you're being mindful and again asking your doctor to check you. All right. So diabetes, what is it? All right. It's where you have too much sugar. You can hear the elders say this, and they can talk about, oh, you got too much sugar in your blood. Well, we call it glucose there. All right. Over time, this high blood sugar or this glucose, a high glucose level can damage those small blood vessels in your kidneys. All right. And cause kidney disease. Again, those arteries, those blood vessels, those veins, they're damaged, and the damage to them is what's causing the CKD or the kidney disease. All right. Nothing that you've done, like I said, it could be anything from something that is passed down through your family. Who knows? All right. So don't blame yourself. But what we want to do now is engage, be active participants. Again, you're the MVP player there on your team as far as it is concerned regarding your health. All right. All right, so there's diagnosing diabetes. There's normal, all right, when you get this test, we call them the A1C test there, your primary care or your nephrologist may have for you. There's a blood glucose level there. That's less than 100, which means it's in a normal stage there, normal stage, less than 5.7 for the A1C test result. But when you get to pre-diabetes, all right, that's definitely here. You want to be mindful and definitely make some changes. Again, behavior changes. That's your blood glucose level between 100 and 125, or the A1C test there when you go in is between 5.7 and 6.4. Definitely here is what they call pre-diabetes. All right, so definitely here you want to make some lifestyle changes, and I'm going to share more about it. All right, and definitely here, there, that last line there, column is diabetes. Definitely, your fasting blood glucose level there is 126 or higher. On the A1C test, it is a 6.4, 6.5 or higher. All right, now that we're talking about it, what's the next cause? What's the next major cause of a CKD? Age, alcohol, diabetes, or high blood pressure? Here we go. It's high blood pressure. All right. Hypertension. All right. Is the term that medical professionals use. All right. So this means that your heart is working too hard. All right. To pump the blood. The blood flows through the blood vessels, those veins, those arteries, like I discussed earlier, but it's going through with too much force. All right. This that I'm talking about can damage your blood vessels as well. Then again, like I said, too, cause kidney disease. Now, chronic kidney disease or CKD can also cause high blood pressure as well. So sometimes they can go hand in hand, those diagnoses there. All right, so it's very helpful to stay mindful again and to be checked regularly. So that means the blood pressure, we're going to look at that. I'm sorry, excuse me. So we're going to be checking that. Your normal blood pressure, all right, should be between 120, that's that top number there, systolic, over 80, which is that bottom number that you normally see and that they're checking for. And that's what they're checking for when you go out to the health fairs there out in your community, or if you're going into your doctor's office, they're always going to get those vital signs before the doctor even comes in. And here's where it's pretty high. All right, those pressures, the numbers we're talking about, the 120 through 129. All right, this is where we're going to start noticing some creeping up in those numbers. All right, that bottom number, that diastolic number is less than 80. And here's where it's very high, stage 130 over 139, that top number. Right, that low number between 88 and 89. Stage 2, extremely high, that's 140, that higher number, over 90 or higher, that bottom number, all right? And so this is what they're checking for, your medical professionals, and what you should be checking for, all right, regarding your blood pressure. If you don't have a blood pressure monitor, please get one. You can get one at any of the local neighborhood drugstores there. And sometimes it can be provided free if you check with your insurance there. All right. So that's something that we can do to monitor our health. Now, here's something that we want you to ask for. All right. That's a test for kidney disease. Like I discussed earlier, ask your doctor, your primary care, especially at your annual, to be checked for CKD. There's a urine test there that checks for protein, all right, spillage out into the blood. It checks your urine, all right? It can help detect the damage to your kidneys. You can have lots of protein in your urine for up to 3 months or more. If you do, then that means that you have CKD, all right? If you have chronic kidney disease. If you have it for 3 months or more, protein in your urine. All right, as you can see there on the right, this is a test. There's a dipstick. They dip it into your urine there. The urine is captured in this here cup. All right, and then thus they do a lab test, which comes out with your results. Hopefully, again, you're being mindful. There's a thing called My Chart with some of those professionals, and you can definitely check this on your own without having to go in. You can see it there on your My Chart, definitely, and you can keep track of it on your own. All right. Again, like I talked about that urine test, it's also called a UACR test, urine albumin to creatinine ratio. It's done through a microscope. All right. It's detecting that protein there, albumin. It's detecting also the creatinine, which is the waste product from our muscles in your blood. All right. Here's another term, EGFR. All right. Again, another blood test to find out where you are in your kidney function. EGFR is called estimated glomerular filtration rate. All right. And so again, this is another test. It tells how well your kidneys are working. A doctor will look at your EGFR again over maybe a 3-month time span to decide if you have CKD, kidney disease. All right. Estimated glomerular filtration rate. All right. How well your kidneys are functioning. All right. All right, so here are again are the stages there. Stage 1, you're not going to have any, definitely nothing, again, no symptoms. The kidney function is going to be almost normal. Stage 2 there, though, the range is between 60 and 89. That means your EGFR rate. All right, the kidney function, less slightly normal there. Definitely something to note. All right, but going into stage 3 and 3A and 3B there, definitely something to, again, make some lifestyle changes. Definitely need to be talking to your doctor, and he or she needs to be talking to you about what you can do to slow the progression down. All right, so again, those are mild to moderate damage and moderate to severe damage. And the ranges can be between 45 there. That means 45%, definitely down to 30%. All right. And again, we're talking about your kidney function, how well it is functioning. Then there in stage four, the range is between 15 to 29. Serious damage there. Again, you should be talking to your doctor, and he or she should be talking to you about this way before you get to this stage. All right, and then going into stage five, that's less than 15. Again, you're in this thing called kidney failure. All right, decrease in urine output. Nothing is coming out, it may be. All right, and again, kidney failure. So at some point through this, you're going to need to seek those treatments for CKD, and we're going to talk to you about those too. So it's very important for you to know your numbers. That's your A1C level, your blood sugar, or also your blood pressure numbers as well. Keep up with that every day. All right. EGFR levels, definitely. It says that we should be seeking this often. All right. Every 6 months, every 12 months, definitely. And if your doctor is not mentioning this, please open up and engage. Talk to your doctor. Make sure you ask them to be checked for CKD. All right, urine test or a UACR test. Also, through blood work as well, that people, I'm sorry, medical professionals can check for your kidney function. All right, so what are those next steps? I just talked about it, asking your doctor to be checked and checking your blood pressure, etc. All right, what are some ways to prevent? I'm glad you asked. All right, you can again control your blood sugar. If you have diabetes, control your blood pressure. That means managing it. All right, and that is with medications. Definitely making sure you're taking your medications daily. And that means at the same time every day, you want to change some of those eating habits, those lifestyle changes, the behaviors that I talked about earlier. All right, so we're going to eat healthier as much as we can. We know in some communities there's not access to healthier foods. All right, but we're going to show you some ways where you can try to change that. You can also definitely become active as much as you can under your doctor's care. Definitely make sure if you're changing regimens to ask your doctor about it. So be active, get that blood moving, get those endorphins going there if you are able to and it is comfortable for you. All right. All right. So ways to manage this, just like we said, take your medications as you should, as prescribed, and also you can talk to a dietitian who can help you make healthier lifestyle changes, healthier eating plans. So definitely talk to your doctor about that. Ask your doctor to be referred to a dietitian. All right, so here's some ways that you can help control your blood pressure. Again, taking your medications as directed every day at the same time. Again, taking your blood pressure at home, going to your regular appointments. Again, eating healthier. So that means when we're going out to the grocery stores, all right, so we're going to look at the back, all right, of every item that we pick up. So we're talking about sodium here. Sodium, which is salt, all right, when we and consume lots of it can contribute to high blood pressure. So there you can see 2,300 milligrams or less per day. That means each and every meal, each and every snack that I'm taking in and consuming, the amount should be no more than 2,300 milligrams. As for myself, I try to keep it at 1,500 milligrams, definitely because I can feel it when I do consume excess salt. All right, but traditionally 2,300 milligrams. So you want to make sure you're being active and again healthy. All right. And so CKD again can be preventable. We talked about the sodium there, the salt that's in those added ingredients into our food. Definitely when you're out at the grocery stores, if you want to buy or if you can buy no salt foods, low salt foods as well. If you're buying those canned food, those canned ingredients, like I said, some we don't have access to some healthier food options. If you're buying canned foods, definitely make sure you rinse them off first. Rinse them off with water and then pour the water off, and then you can consume and heat up. All right. And therefore, you're limiting those ingredients, the excess sodium, like I talked about. You're limiting some of those other added ingredients there that you may not need to consume. All right. So want to eat some healthier fats. All right. And also more fruits and vegetables. if you have access to them. And we're going to control the portion size. All right, so now we're talking about that sodium there. Let's see what has lots of sodium there at the grocery store. So we talked about this. We're going into the store. All right, we're going to buy some items. What are we going to buy? Well, we want to limit, all right, some of those frozen dinners. All right, so what are you talking about, T? I'm glad you asked. That could be some of those meals. I'm not going to have a brand name here, but some of those meals that are frozen, they're flash frozen, already prepared. They are full of sodium, potassium, phosphorus, and other added ingredients, preservatives there, so that they can be preserved and kept over time. Now, some of those ingredients I said are not as healthy for us. So we want to scale back on buying some of those foods, all right, those frozen dinners. And again, when I say canned foods, all right, we're going to talk about that. We want to kind of scale back. But like I said, in some areas, you don't have access to these live options, healthier options. So if you do buy them, like I said, rinse them off before use. All right, definitely want to make sure you buy no salt. All right, and also those packet snacks, those cookies, those chips, those crackers, full of salt and sodium. It is. All right, so we definitely want to scale back on that. All right, and those ingredients. And definitely, if we want to make any of these snacks, we can do so ourselves. Make them from scratch if you can, if you're able to. All right, we want to eat fresh and maybe frozen vegetables. All right, rather than eating the canned foods. But like I said, again, if you got to get those, get it with no salt added. So fresh frozen vegetables, definitely in that frozen section. There can be those carrots there. Definitely, they have no salt added. And you should look on the back of it to see how much sodium is there in it. All right, now we're talking about if we're taking away or limiting or slowing down some of the consumption of some of these items that we love, these cakes, these cookies, these crackers, these chips. What are we doing, with our foods? How are we, because we want to make sure that they're flavorful, palatable, we want them to taste good. You can use some dried herbs, fresh dried herbs, lemon juice as well, I love, and other spices, garlic there. I love garlic. And not saying the garlic salt, just the garlic itself. You minced garlic, you can buy as well to flavor your food. Ginger, some people like to use, but fresher ingredients there. I believe there to the right, maybe some thyme. Maybe use thyme in some of your ingredients added to some of your dishes there. Definitely want to make sure we're drinking water instead of those sports drinks. And definitely those sugary drinks we want to limit and scale back on. That means those sodas as well. Sodas, the sports drinks, even some of those things that are packaged or look like fruit juices. Definitely they have lots of salt and sodium and definitely lots of sugars we're going to talk about as well. So want to scale back, drink water as much as you can. Definitely. You can't go wrong with that. All right, so here's some nutrition labels that I talked about. That low sodium we talked about. So here we pick up a package at the store. We're going to turn it around and look at the back. It says the sodium level there is 460 milligrams. For me, that's a lot. All right. So we want to, again, be no more than 2,500 throughout the day. That means breakfast, lunch, and dinner, and all those snacks in between accumulates to 2,500. Now, if this is 460 milligrams, and it says there that it's 20% of the serving considered high, it says it on the package, all right, this may be a high sodium food. All right, how are we deciding that? Because it says 460, all right? Low sodium foods, 5%, all right, or less daily value. So here, that 20% there that you see, it may be considered high. All right, so we want 5%, all right, or around that number. All right. We want to limit the sugar that you're taking in and consuming. Definitely, if you're diabetic, we want to make sure. All right. And so when I say eat fresh frozen fruits and vegetables, we may be going to those strawberries, putting some of those strawberries in the yogurt there, putting them over our plain flakes in the morning. But definitely, if you're diabetic, you need to be careful and mindful. Definitely talk to a dietitian because some of these vegetables, and I'm sorry, some of these fruits definitely have natural sugars that can spike diabetes. All right. So, but instead of eating those sweets, like I talked about, those packaged cookies, the cakes, instead of that, we can consume some blueberries there. You can see blackberries, maybe raspberries, and cherries, maybe, and strawberries. But definitely reach out and talk to your doctor. And if you have a dietitian, seek which items you should consume. Definitely, again, we want to avoid those processed items, packaged foods that have that added sugar in there. And sometimes those cereals, all right, are laced with excess sugar. All right, so we definitely, again, want to be mindful, and we're going to turn those items on the back and we're going to look at those levels. All right, and again, those sugary drinks, sweet teas, all right, can have excess amounts of sugar there. If you can get, and I know I live in the South. That's tea with no sugar in it. All right. And then you can add it as needed. But definitely you want to slow down on the consumption of that. All right, so here's the label there, the nutrition facts on the back of an item. And we talked about sodium. So now we're going to talk about the sugars. What are you looking for? All right. And so sugar, 4 grams of sugar is 1 teaspoon. So low in sugar is less than 5% a daily value, just like we talked about for sodium. So a high added sugar is 20% or more. So this item we looked at there, when you look at sugars, it says includes 23 grams of sugar. The added sugars there is 46% of what you should be consuming for your daily value. So that's too high. All right. Again, what you should be looking for is at 5% or less daily value there. And that's for the items again at the grocery store. And hopefully this is helping somebody out there. Another thing we want to do is choose some healthier fats. All right. That means lean meats. All right. Those meats without the skin on it. All right. We want to try some other items. I am a chicken and rice girl. I love chicken and rice. But one thing I learned is I can replace that rice with something called quinoa. This word here, Quinoa, I can use that. It has lots of protein in it as well. Some people use this to replace meat, but I use it to replace, again, like I said, those carbohydrates, which is the rice that I love. And you should try it. Some people say it needs to be seasoned. Well, I just talked to you about all the seasonings you can use. We want to try to, again, cut out some of those Mrs. Dash seasons. Nothing to Mrs. Dash and those companies that make that. But we want to eat fresher ingredients. Mrs. Dash may have more potassium in it that we may want to consume. All right. So there's unsaturated, saturated, and trans fats. All right. Those saturated fats are some of those that we want to try to limit and slow down, and eventually slow down and stay away from. All right. All right. So again, we talked about eating fresh fruits and vegetables and filling your plate with that. All right, you want to control your portion size. And when I talk about that, your meats there, you may want to eat a palm full, the size of the meat that you're eating. See that 3 ounce of lean meat is that palm there, or maybe a cupped amount. All right, and that's what I'm talking about, controlling your portion size. All right, you may want to eat slowly when you make your meals, or you eat your meals from your plate. Eat slowly. All right, stop when you're full. You don't have to eat the whole plate. Maybe you can save some for later. Definitely, we're going to check those nutrition labels there if we can. That's why we love for you to prepare your own meals. And American Kidney Fund has a website there you can go to, and I'll talk to you about it later. And they can share all ingredients and recipes that are for kidneys and definitely eating healthy while you have kidney disease. So stay tuned. All right, so here we go. We're talking about eating healthier, kidney-friendly meals. All right. Definitely, again, like I said, I'm going to share the website. So as you can see the screen there, we've got lots of fruits, lots of vegetables there, just a little, and that could be a hand cupped there, grains, vegetables, healthier fats there. And we're going to talk about how to plan that kidney-friendly meal. Right. All right, so what foods fit into each group? I'm glad you asked. There's protein, which are meats, fruits, definitely you know about. Some of those breads and grains, I talked about that quinoa instead of that rice. All right, and when we're talking about breads, that can be broken down into sugars. once it reaches our blood and it breaks down in our stomachs there. It can be contributed to diabetes, eating too much. But definitely catch out kitchen.kidneyfund.org. All right. And there again, we have professionals who are able to share what, like I said, those recipes that could be a lot healthier for you while you have CKD, chronic kidney disease. So definitely take note of that, write that down, kitchen.kidneyfund.org. Definitely have some recipes that are tasty. You can prepare for your families as well. We want to make sure that you're also active. Being active means being healthy. All right, we talked about it earlier, but going more into detail, maybe about 30 minutes routine. 5 days a week, try to, all right, get moving, become active. As you can see there, there's a guy down at the bottom there. He's just doing reaches left and right. All right, you could also do some twists there. All right, to get your blood flowing, to get moving, to help your midsection there. All right, those reaches to the right, to the left. You can also do reaches down to your toes. All right, if you can reach the floor there, definitely. If you're not able to, definitely be mindful of that. You want to make sure that you're comfortable and not do anything that can also hurt and harm you. Walking, you can walk the dog there. Definitely outside, getting some air while you're out in your yard. But we want to make sure that you are moving around. All right. Other ways to prevent or slow CKD: stop smoking. All right. Limit your smoking. I know people can't go cold turkey, but definitely ask your doctor if you're having problems with this as well. All right. That your doctor may be able to assist and give you something that can alleviate those urges, those cravings. All right. So slowing down the smoking and the vaping. All right. And trying to cut it out altogether. We want to limit the alcohol use there as well. Alcohol definitely can be damaging depending on how much you are consuming. All right, so we want to limit that and definitely talk to your doctor about that. All right, so thank you so much for joining me again. This is T with CKD, all you need to know and how to prevent it. All right, and I am your kidney health coach. But definitely write down some of these tips, some of these strategies that I just shared with you. Take those steps to manage your diabetes, your blood pressure. We're going to try to eat healthier as much as we can. Again, some of our neighborhoods may not be accessible, but we're going to try to reach out there and also take steps to be more active. All right. All right. Here's some treatments if you're still with me for CKD. Again, when those latter stages is dialysis, as some people have heard, and also a kidney transplant, which is something that has to be planned. All right. It may take some time. And also, if you're on the wait list, that's going to take some time. And medication management. Now, when I say medication management there, when you're in ESRD, ESKD, those end stages, that last stage of kidney disease, and your kidneys have stopped functioning altogether, totally there, that may mean going into hospice, all right? Palliative care or hospice if you don't choose a dialysis or kidney transplant. So some people may be uncomfortable about that, but these are the facts there, and we do want you to be aware. So what is dialysis? I'm glad you asked. Hemodialysis can be done at home. You can go into the center there as well. All right, these were your kidneys. Again, they're not cleaning out the excess, the toxins, the excess fluid that we have consumed in our body and built up. So definitely, we're going to go on a machine to help us clean it. It's going to be similar to an artificial kidney, I say. It's going to clean out that excess fluid there. But your kidneys are functioning every day, 24 hours a day, 365 days a week, a year, I'm sorry. What dialysis does is it cleans your blood, but it only does this 3, maybe 4 days out the week when you're going in into a center. So definitely we want to make sure that you're mindful of that when you take dialysis and perform dialysis. So definitely, in order to get the optimal amount of time there, you may need to make sure you're going into each and every session. All right, like I talked about hemodialysis. This is a machine there on the right. You go in, there is a dialyzer there. It can filter and clean your blood. It removes, again, the waste, the toxins, and the tube there carries that cleaned blood back to your body through again, that machine there. So there, as you can see, there are 2 tubes there placed there on his arm. The person you see there, the individual, the blood comes out from the tube into the dialyzer, throughout the machine, back into your body there. hemodialysis. This can be done at home at your own convenience if you are approved to do so. Right now, everybody's approved to do so 6 days a week or more at your own convenience, a couple of hours, 4 hours, 6 hours, as it is prescribed. All right. And your doctor, again, works with you. And again, you can engage with your doctor and ask all about it. Not everyone qualifies for it. Here's something called PD dialysis, peritoneal dialysis. So what it does is use a fluid that's in your own body, in your belly, all right? And it uses that to remove the excess toxins, all right, to clean your blood there. It can be done in any clean area, in a dry place. People who are still working, they may choose this option there if they qualify for it again. It can be done at home, at work, and it can be done. Some people do it in their cars. Again, it has to be a clean space to do so, and if they're comfortable enough to do so. But definitely, it can be done at home. Again, at your own convenience. It uses the lining of the belly there again to act as that filter. All right, and there's also a solution that you use for that process. And also it drains out, can be drained out. All right. So you're cleaning that blood there whenever you want to, however you want to, and for how long you want to throughout the day or even at night. All right. And there's also transplants. All right. A kidney transplant, which is something that I have. I have only one kidney, and that is the one that was donated by an organ donor. And I do thank his family and thank God for it. All right. So this is a surgery where we're taking one kidney from a person. It could be a deceased person and into another. All right, and so that they can continue to live. All right, so after a transplant, you will still continue taking medications. All right, immunosuppressant medications, so your body does not reject the kidney that is taken from somebody else. All right, so as long as you have that transplant, as long as you have that kidney from that belongs to someone else, all right, you'll be taking this medication to keep you alive. All right, so here are types of transplants. There's a living donor transplant. Again, that's something that has to be planned way in advance. All right, that's if someone who is healthy, they decide that they want to donate their kidney. Again, we have two. You can live with just one. All right, they can donate their healthy kidney to you. Here it says how long does the transplant kidney usually last? Well, up to 10, 20, 15, 20 years and even more. All right. There's an individual who's had one for 50 years. All right. And so this is maybe what your doctor may ask. It may be the most optimal, but a lot of people don't have a live person to donate. All right. And so therefore you can go on the wait list or there's a living donor paired exchange program. All right. So if you do have someone that you know who is healthy enough to donate a kidney, their own a living person, they can donate their spare. And if they don't match, the blood type does not match yours, there may be someone, say in New Jersey, who can help and assist with that. All right, somebody in New Jersey may have a person, a living donor who would love to donate their kidney, but they don't have a matching, like I said, blood type. So there's a program called the Paired Exchange Program, kidney donation, where both of them can have the procedure to remove their kidneys at the same time. All right, and the swap can happen where my blood type matches that person in New Jersey and the New Jersey blood type, vice versa. All right, and so that can be exchanged. Each individual can get the new kidney at the same time, and this surgery or procedure is happening all together. And again, this is done in advance, performed in advance and is structured. So definitely, like I said, there are options there, but it's limited. All right. We don't have enough donors. We don't have enough living or deceased donors. Here's the last one, the deceased donor. Like I said, definitely you have to be put on a wait list. There are only a number of centers within the U.S. that can perform this procedure. So definitely you want to look in your state to see where they're located. You want to ask your doctor, your nephrologist, about a transplant. Definitely, if you're going into those latter stages, engage with them, ask them, say, hey, I want to be listed for a transplant. There is an evaluation, there are requirements, right? You have to meet before this is approved, like I said. So definitely, if you have CKD and you're going into those last stages, definitely be thinking about that way in advance, all right? All right, and the last one, like I said, the treatment there, if you're in stage 5, definitely, and your kidneys have stopped working altogether, that's medication management. All right. So as the progression continues, the and your kidneys continue to decline, and also, again, like I say, stop altogether. And if you don't choose diabetes, and if you don't choose the transplant, the medication management, which is hospice. All right, that hospice care. All right, in hospice care, they're going to give you some medications, maybe to make you feel comfortable. Again, because you've chosen not to do dialysis or transplant. And again, like I said, at this stage, if you've chosen this one, there may be death. All right, that death may be coming about a little more faster at this medication management or hospice stage. All right, they're going to give you medications again so that you can be a little more comfortable and you can be probably at home with your loved ones and your family. Okay. All right. All right. So I talked about this kidney transplant, dialysis, and medication management, which is palliative care and going into hospice. All right. All right, and this is just an activity there if you're still on there with me where you can connect which is what, those terms that we talked about. When your kidneys are permanently damaged, all right, and they're not working like they should, it's called CKD, chronic kidney disease. The most common CKD causes, some of the most common causes, diabetes and blood pressure. Some of those symptoms there that I talked about, they don't appear until the latter stages. Usually you're going to be, again, tired, lethargic. You may not have an appetite there. There may be some swelling, some edema in your extremities. That's your hands, your legs, your ankles, your feet, and then sometimes your face. You may be feeling some anemia, some gout there. Definitely tired, some insomnia. You're going to be up late at night, can't sleep. You're going to feel some symptoms there. You're going to have some decreased output in your urine. So you may not maybe going to the bathroom as much as you used to. There may be some UTIs, urinary tract infections, definitely some kidney infections. You're going to have some challenges there that you're going to notice. All right, definitely talk to your doctor about what you can do to alleviate some of those the pain or symptoms. But before that, you can definitely take some tests, all right, to find out way ahead of time. And again, those tests, the EGFR test, estimated glomerular filtration rate, how well your kidneys are functioning. You can take the UACR test there, take the urine. There is what they call a dipstick there to dip into your urine, and also a blood test to find out how well your kidneys are functioning. But what you can do is control some of the diabetes, the blood pressure. You want to eat healthier. You want to be active. And here's one thing that I did not add. You want those pain pills, all right? You want to make sure that you take Tylenol instead of maybe some of the ibuprofens, some of the Aleve. Some of them may eventually cause damage. All right, so definitely Tylenol is maybe a more healthier option. Don't pinpoint me on this, but definitely NSAIDs, NSAIDs, are some of those that you may not want to take as much of if you're trying to slow down progression of kidney disease. Hear those references there. All right. So American Kidney Fund, all right, is a program that I'm coming to you with. All right. They're sponsoring me. AKF, become a kidney health coach yourself. And definitely you want to teach or educate your community there at kidneyfund.org. They provided the resources and the materials here that I just presented to you. You can also go to the American Diabetes Association, CDC, the Centers for Disease Control and Prevention here. All right. Also, Food and Drug, FDA, and Harvard Chan School of Public Health. NKF, the National Kidney Foundation, as well, which is another organization nationwide here in the States. Definitely check them out as well. All right. Well, thank you so much for joining me again. I am T, your kidney health coach. This is brought to you by American Kidney Fund. If you don't mind there, take a moment to complete our quiz, the evaluation form. Tell me, how did I do today? All right. How did you enjoy this here session? All right, with your kidney health coach. Thank you so much for joining me. Thank you for taking your time. You could have been anywhere in the world, but you chose to stay here and listen to what we had to say. Thank you so much for joining me.